Hi, good morning, good afternoon, and good evening for those of you tuning in. My name is Mehta, and I'm a second year MPH candidate at the Milken Institute School of Public Health at the George Washington University here in DC. In today's presentation, I'm going to be talking about employment in primary care, the fundamental needs of health equity among transgender and gender non-conforming people in Puerto Rico. I'd like to begin by underscoring where we're at in terms of the knowledge and the literature about transgender and gender nonconforming people. Over the past decade, we've seen substantial effort within the field to better include people of trans experience and who are gender nonconforming. However, there is still limited data regarding this population. There has been an increase in effort, and that has been seen, but there's still a need to really be more involved and really include this population in our studies. Transgender and gender nonconforming people may experience barriers to care for a variety of different reasons, including discrimination and lack of access by healthcare providers. Transgender and gender nonconforming people continue to experience suboptimal healthcare, social exclusion, and lower quality of life. In this study, we seek to explore the social determinants of health, perceived barriers, and access challenges among trans people and gender nonconforming people within Puerto Rico. Ultimately, the goal of this study was to attain findings to inform future initiatives that would help to reduce health inequities that affect this population. Our methods. In this study, we recruited 212 individuals of trans experience or who identified as gender nonconforming. The data was collected in the summer of 2020 when, in fact, we had COVID-19 that had just begun in March 2020. Therefore, we had to be flexible and willing to work with the data collection that was going on. So, we distributed online data collection, and we also submitted paper formats using community activities and community outreach to get people of trans experience and who are gender nonconforming to participate in our study. The data that was then collected was analyzed using SPSS. Results. Majority of our respondents were transgender women, as you can see with almost 47%. The average age of our participants was 38 years old. A little more than half were below poverty. Almost 66 had a technical degree or a college degree. And we can see there is a significant data showing that there's discrimination in the healthcare field. From the data that we collected, we've here illustrated some of the findings that we found. Across the board, we see that the three most pressing issues among transgender and gender nonconforming people are gender-affirming surgeries, access to hormones, and mental health care. This is a huge deal, and it illustrates a bigger issue, showing that these populations might not have access to these resources, or they're being discriminated, or they're not having the adequate funds to access these type of resources for their own well-being. I'd like to end by discussing the findings and implications from the study. Given the findings, the unique healthcare needs of the transgender and gender nonconforming population, the findings serve as a call to action to improve the overall access to care and conditions of this population. Transgender and gender nonconforming people face barriers to healthcare due to a variety of different reasons, including discrimination in the healthcare setting, employment, and even public policy or lack of access and awareness among healthcare workers. There's a great need to develop robust policies and interventions that centers the lived experiences of the transgender and gender nonconforming population. There is a need to understand health equity, and there is a need to understand what the gaps are in order to form very beneficial and productive policies that include this overlooked population in national plans and ensures that these people are attaining the proper health care, access to resources, and fundamental rights that every individual deserves to receive. Thank you.